got a position here in South Korea. I am located in Seoul. So it is Sunday morning here, very bright and early Sunday morning. I know for you guys it is afternoon, East Coast. But yes, it takes me about 14, 16 hours to answer, but I always answer and I am always available. If you have not joined our WhatsApp group, you guys are missing out big time. If you're part of the course, you should join our WhatsApp group. There is a tons of information that's put out during the WhatsApp group questions.
How do
So,
we join?
well, it's part of the it's part of the course. So I'll talk to you about at the end of it. Basically, we want to make it a community that we are supporting those that are enrolled in a course, so they have everyday support. Whatever you guys need every day. If you have a question about something that you went through the course you don't understand, you can have an answer within the same day. And the students are very proactive too. So all right, we are about to get started. And then now wait at the end. If anyone has question about the course, I can answer and we can clarify anything that you may not know. Okay? At this time, understand that the Kahoot game, it's fast. It's 1 minute only per question. You get points for being right and you get points for being fast. And the game is about to begin. You answer on your phone and you watch the screen for the question. The game is about to begin. All right, so pick your answer on your phone. Piaget theory of development is marked by the growth of language skills and emergence of magical thinking. Where do you see magical thinking? Is that concrete, sensory, formal, or pre-operational period? Remember, magical thinking is normal, right? Use process of elimination if you don't know. You could pretty much eliminate two answer choices by doing process of elimination. 4 seconds. Pick an answer on your phone and done. All right. Good job, everyone. Here, pre-operational, right? So it starts with sensory modem. That's the from the very very toddler, and then you have pre-operational right after that, the 2 years old, right? So they have magical thinking after the pre-operational. What do you have there? Anyone? What's the next? Unmute yourself there.
Concrete.
Concrete, right? And the last is formal. A lot of confusion between concrete and formal, right? Which one comes first? So it's concrete, then formal. Think about formal as the highest still way of dressing up, right? So formal is before concrete, magical thinking, language skill, high yield, pre-operational. Write it down. Okay, super high yield. All right, as you can see here, Janet, she was the first to answer, and she got it correct. So she got the most points. Then Ora, and then Solomon. So you have to be fast, and then you have to be correct to get your points. Next question is coming up now. Let's see who's gonna take the lead. Where do you use seabird, guys? All right, we got 11 answers. Wow, 12. And that is right. There is no comments here. Everyone got it correct. Good job, guys. You picked your answer fast. You read the ask yourself, you as you read the question before you look at the answer, ask yourself, what is the question's asking me? And answer the question without looking at the answer. And then you simply confirm, go through A, B, C, and D. And if you already have the you if you already know what you're looking for, it'll make it the question much, much easier. All right, Jeanette again and Ra and Solomon, they kept answering fast. They are on the lead here. All right, easy question. All right. We have 14 answers, 20 seconds left. Which non pharmacological method is most likely used for PTSD? EMDR. And guess what, guys? You need to know the phases of EMDR because oftentimes the test will give you a scenario and ask which phase of EMDR is the scenario referring to. Okay, so second question about PTSD. Few things that I want to mention. Which medication do you use or you could use for patients that have nightmare? Anyone?
Production.
Prazosin, very good. Now, you can also use for PTSD, you can also use an SSRIs. However, the mainstay therapy is of the EMDR. You can use CBT as well. Okay. What is the difference between PTSD and acute stress disorder?
The time difference.
Okay, so the time difference. So if it's less than a month, it is acute stress disorder. If it's more than a month, it's PTSD. Do not get confused with adjustment disorder. In order to be PTSD or acute stress disorder, it has to be traumatic, a rape case, a case of death, someone being molested, things are like that, right? Now, if the question give you a time frame of 3 weeks, but it says that the person is a veteran, been to a war and been diagnosed with PTSD, do not call for the 3 weeks. Basically, it's saying there is a reoccurring, there is a new event, but once the person has a PTSD, it's always a PTSD. Do you guys understand this? Very important because it will trick a lot of people. Because if we just blindly just look at the question, it says 3 weeks or 2 weeks, the person had a car accident, but we don't read the rest of the question in which says the person uh been having the diagnosis of PTSD, so the answer will be PTSD regardless of the time. Okay, I get a lot of people getting this question wrong, so please, if you don't understand, let me know at the end of this encounter today.
Okay, to clarify, you're saying if it says
Actually,
you're a veteran.
hold on. We'll go back on this
Okay.
one in a second. All right. So hard question, right? Because of the time frame, but understand the thing that you want to understand here, it did not say what is the correct diagnosis, right? Because that would have been difficult to answer. All questions in a test most likely will say, what is the most likely diagnosis? Okay. And that comes to mind for most questions. However, when it says for one specific disorder, which is GAD, it has to say 6 months in a time frame. Okay, going back to the previous question, acute stress disorder versus PTSD. Okay, so when you have, it doesn't have to be a veteran. Let me clarify. But most questions that comes with PTSD is related to a veteran, someone that's been to war. That's another cue. Okay. Now, what I meant to say is that if anyone has a dramatic, traumatic event, whether it was a car accident, a rape, a war uh, incident, and they have been diagnosed with PTSD, and now they have a new incident, let's say a car accident, and the person comes to you 3 weeks ago, and the person comes to you and say, "I am so fearful of leaving the house to go to work. I'm having dreams. I'm having X, Y, and Z." And the answer has acute stress disorder or PTSD. You need to pick PTSD because even though it's a new incident of acute stress disorder, one that has a PTSD diagnosis can never regret to an early uh, form of traumatic incident. Does it make clear?
Yeah, my
Very
question
important.
was, because
Okay?
they're a vet, you consider them to be a PTSD patient, or am I
Absolutely not.
taking
No,
it too far?
absolutely not.
Okay, right, all right.
Yeah, absolutely. Anyone with a traumatic event, usually
Okay,
most of the time it comes to be a veteran of war and things like that. But PTSD can be anyone. But the key of the question is it tries to throw you off with a 3 weeks, 2 weeks incident that just happened now. But if you read the theme of the question, it says someone has been diagnosed with a PSD event, and then X, Y, and Z happens 3 weeks ago, and the patient now is fearful to leave the house, having dreams, then a lot of people will pick acute stress disorder. Why? Because they look at the 3 weeks. But when the answer really is PTSD, because they already been diagnosed. It's like one with bipolar 1 disorder and bipolar 2 disorder. If you've been diagnosed with bipolar 1, you can never be bipolar 2. Okay. You can be bipolar 1 in remission or in depressed state, but you cannot be bipolar 2 or major depressive disorder. Okay.
okay.
All right. So Jeanette still on the lead there. Next question, question number 5 for today. Okay, well done, guys. Accutane there, right? So Accutane, it's a medication for acne, can cause birth defect. Accutane can cause birth defect. However, we know the steroids of any kind could cause mania or depression if someone is stable on a steroid. I mean, on the really SSRI or SGA, a second generation antipsychotic, or FGA, the first generation antipsychotic, and the PA or a doc adds on a steroids here, this in disguise as prednisone, then that could be the reason why the patient went and now it's unstable. Okay, so prednisone is the answer here. All right, we got 30 seconds left. Maybe we're missing one person to answer the question. 10 seconds. Okay, well done, guys. That is a clear case of negligence. The Tarasov principle is duty to warn, right? So basically, you have a duty to warn when someone is an immediate possible threat. But remember, the Tarasov principle does not apply to every state. The most likely answer to questions involving the Tarasov is to call the police or to call the nursing board. And that sounds very vague. And the reason for is because the nursing board would tell you if it applies to your state or not. Okay. But that is a clear case of negligence. If you, as the prescribed, placed on 1-to-1, the nurse decided on her own to simply take the patient out of the 1-to-1, the patient went ahead and committed suicide, then that is a case of negligence. Okay. Bandy, there's second place now. Twenty seconds. All right. So do not get confused. Circumstantial thinking versus tangential thinking. In circumstantial thinking, it goes around, 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 and finally answers the question. Tangential, it goes around, 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 and never answers the question. Okay? So please know this. This is high you too. Jeanette took the lead. Well, I think she's been on the lead. All right, we got 14 answers, 15 answers. What do you tell all teenagers or younger than 23 years old before you prescribe a antidepressant? Any class of antidepressant. All right, well done. So no explanation here. You guys got this. All right, Bandy here is on a roll. She got few in the row. Correct answers. Next question. All right, if you read too fast, It says would not be effective. Would not be effective. Okay. All right. So hopefully you got that correct, right? You can use Suboxone, you can use buprenorphine, and less preferably, you can use methadone, but that would be like a second choice because it could cause our heart arrhythmias. But for someone that's going through opioids withdrawal, right? You do not give a composite. A composite is for maintenance of alcohol for those folks that are trying to stay absent, not drinking at all. A composite would be a good choice, right? It's not even utilized for alcohol withdrawal. We need to use benzos. So understand Siwa versus Cal is important and here understanding the question. Very classic questions, how you guys know the knowledge and yet you missed the question because you read too fast. Ask yourself, what is the question asking me? So you know exactly what you look for in the answer. Okay. All right, Ben took the lead now. Okay, well done. Everyone got this correct. Now ensure you know what the mower, the plantar, and the palmar grass roots flex are because they are high yield. Okay, I'm not going to cover, but we cover this in our course. Please make sure you know this information. Argues with authority figure, gets easily irritated. All right. So if you look at the stem of the question, it specifically said argues with the authority figure, the mother, the father, the teacher, and so forth. That is a classic oppositional defiant disorder. Okay. Understand that, but also know what conduct disorder is and how it's different from oppositional defiant disorders or disruptive mood dysregulation disorder is very important. These four answer choices, they are super high yield. You need to know them in detail for your test. The least suitable, the less likely you would prescribe. Hard question though. All right. So very hard questions, unless if you took our course or one of our tests, it's a difficult question. If you encounter a very hard question, you look at the question again, ask yourself, what is the question asking me? Do process of elimination. You don't know the answer. Do your best to answer and move on. Do not lose the seconds that that's precious for your time. If you do not know the answer and there's a specific knowledge question that there is no test taking strategy that will help you, don't get yourself bothered by. Understand it's just one question. When we are taking the PMHNP, we need to flip the script. We're not in school anymore. That we're like, oh, I want an ace. It doesn't matter. A 70 is a pass. So you just need to know this could be just a dummy question, which means that they're not going to use to calculate your score, or could be a question that you don't know. Either way, it doesn't matter. Do not let affect your morale and how you see the next question. All right. So she says, I will be faithful to you by not telling your parents, right? So that's fidelity. Understanding your ethical principle, all eight of them, is important. You should really, really know the details because they all sound very simple. But how can test makers make it more complicated to you? Okay. So we also have a question bank that'll help you do more questions that help you learn faster. All right. So, you guys have take St. John words, right? I think you were thinking more of serotonin syndrome, right? But here asked about EPS symptoms, so kava would be the one. Why? Because kava would potentiate increase the antipsychotic medication. Okay. All right, so that is dopamine. It does sound like a lot like serotonin, right? But that question is related to dopamine. Okay. Okay, very good, guys. Very good. That's how the majority of you guys got this right. Acute drug-induced rhabdomyolysis. When it comes to Depakote, there are two FDA warnings for this medication. What are they? Unmute yourself. Anyone?
Hepatotoxicity,
Yes. And
pancreatitis.
perfect. Well done. Thank you. So make sure you know that, and also make sure you know that it could cause birth defects, uh, things in that nature. Okay. So anytime any medication that could cause birth defects, and you see one of the answer choices being a pregnancy test, most likely that could be the answer choice. Obviously, it can change, but just keep your eyes for answers that involve both birth control or pregnancy test. Well done. So it's needless to say that if the question asks about Steven Johnson syndrome, and the question is about carbamazepine, and the answer choice is Asian population, you'd pick that. The same question, if it asks about Steven Johnson syndrome and does not say anything about Asian population, what medication would you pick? Which medication can cause Steven Johnson syndrome? Carbamazepine. Say it again.
Lamotrigine.
Lamotrigine. So
Lamotrigine, I'm sorry.
yes,
Lamotrigine.
so pay attention because lamotrigine, carbamazepine can come as the true answer choice. So you need to discern if there is a mention of the Asian population or there is no mention of it, and knowing that which one to pick. Okay, well done. Thank you for participating. Use process of elimination if you don't know how to answer this question. Okay, beautiful. All right. So when we read the question, it's a patient that you know. He's been stable on the same medication for 2 years. Something has happened. It's unlikely that you need to increase the medication, maybe a second choice, but something has been added to his routine to throw him off to the point of having hallucination, right? Well done. Proud of you guys. You guys all got it correct. So great job there. All right. So you could have eliminated circumstantial thinking and tangential, right? So now it comes clang association or derailment. So it's a derailment. It doesn't it doesn't rhyme with an answer, right? So it doesn't answer the question at all. Tangential, at least it kind of makes a little bit of a sense, but this is a very loose derailment here. It's a doesn't even come close to be tangential. Okay, so please understand those terminology. Look them up to have a clear picture of what they are. All right, we got about 20 seconds left. Well done. Everyone got it correct, but make sure you know the difference between those terminologies. Use process of elimination. All right, so this was a hard one. Yes, most of you guys couldn't answer the question. Now, we know that's not oppositional defiant disorder, so we are down to three answers. And this inhibit is what described, if you look at the stem of the question, it says excessively talking to strangers, being overly friendly with strangers. So, by the stem of the question, you could possibly pick the right answer, even if you did not know. So, good job with that. This inhibit social engagement disorder is the correct answer. 11 of you guys got it correct. Okay, so very good. So you could, why it is not Tourette's? Someone please give me the answer there.
It doesn't have one voice take on it.
Okay, so Tourette's, you need two modem ticks and one vocal tick. So eliminate that. It's not stereotypic movement disorder either, or persistent modem and vocal tics disorder. Why? Because usually they have to be present for over a year, has only been 3 months or so. So this is a provisional tic disorder. Okay, well done. Use process of elimination. 15 seconds left. Well done, guys. Well done there. That's idealization. I don't want to talk much about that, but I want you to focus on regression and repression. Regression is turning back your age, like curling on the ground with your knees to your chest in the fetal position. And repression is repressing the thoughts to an unconscious stage, and no also sublimation. Okay, well done. Most of you guys got this one right. Solomon is taking the lead there, keeping the lead, should I say. Unlawful confinement of a patient. 30 seconds. Okay, very good, guys. So you need to know those 11 or so law cases that are very famous to be on a test. One of them is O'Connor. O'Connor was a guy that perhaps had some hallucinations or had some psychiatric disorders, and the doctors kept him in a hospital for 15 years until he said, "Hey, this is not right. I want to take this case to the court." And it was known as the Donoso versus O'Connor case, in which we are not allowed to keep a patient against his or her will if they do not pose a threat to themselves or others. Okay? Know this case, very famous, most likely will be on your test. Easy question. Let's do this together, guys. Come on. It's an accept question. Ask yourself what the question is asking me. Oh, that's definitely a wrong question. So I apologize here. None of these. All right. So let's talk about the. Uh, apologize here. This was keyed in incorrectly. So when we're talking about DBT, the answer to a DBT question, it's about Christ intervention. So the goal of DBT is Christ intervention. And who created DBT?
Lanham.
Man,
All right.
mm,
Marshall Langham, right?
mhm.
So it's very important you to know. Not many people need to know the name of who created what, but that is one that you need to know. The main goal is decrease suicidality or decrease crisis. All right. 5 seconds left. Wow. Well done, guys. I would expect to get more people on this question, but you guys did awesome. One of the only reasons that you discontinue a SSRI or another medication is due to the risks of suicidality or increased suicidality, right? Here we have an SSRI that we give to the patient. So the right answer for the board is to discontinue the medication. You do not want to decrease, you do not want to increase or change your medication this time. Okay. So obviously in real life, you still have to treat the patient, then you most likely would find out the alternatives, but for the test, you want to discontinue the medication. Okay. So even if you didn't know the question, the answer to the question, you could use process of elimination, right? So he was frustrated. You want to know why. So you wanted to educate, you wanted to explain the mechanism and diagnosis of encopresis to the patient, to the parents, right? So just looking at the question, you could possibly pick the right answer. Okay, well done, guys. If you look at the microcytic anemia, so you know it's anemia, so it has to be iron involved, right? So you could eliminate the yellow and the blue uh, options there, right? Definitely would need the CBC and then vitamin B12, B9, and iron. Okay, good job, everyone. Okay, well done, guys. So, at 10 years old, you know that they should participate in associated play, right? If they don't, that would be a cue that something is not right. Okay, really read the question and look at the symptoms. Okay, guys, I know this question was a very hard one, right? Because basically it's kind of like lead you in the wrong way by saying that the patient has a dementia disorder, and then you'd look, oh, it can be the red option or the yellow option there, but it asks you to address the symptoms. So therefore, you want to use the atypical. Atypical is the second generation, the safest compared to the typical or first generation. So therefore, you eliminate the red and the yellow, and then between typical versus atypical, which you need to know why it is atypical because of the 5H2A component makes it atypical safer, therefore is the right answer. Okay. Very important. Distinguish between typical and atypical, first versus second generation antipsychotics. All right. Everyone should get this one right. We covered this earlier today. Perfect. Well done. Everyone got it correct. Very good there. Mm. All right. 20 seconds left. Just about. Okay, guys, well done. So anytime patient is on a close rail and you have a fever or sore throat or things along the lines that could indicate an infection, you need to discontinue the medication. Okay, that's one of the reasons why it is so dangerous and you need to discontinue. Okay? Because it could cause the decrease in white blood counts as well. All right. Opioid addiction is dope, and GABA. GABA is your downers. The GABAs are your benzodiazepines, right? Alcohol is somewhat like GABA, but not really. But benzo will be your GABA. Dope will be your dopamines. That's you get the high from cocaine and things like that has to do with dopamine. So opioid addiction, dope, and GABA. You need to know that it's high yield, by the way. Oops. Uh, sorry. Uh, okay. Okay. So during a termination phase, today is our 15 encounter, and is it is the end of our encounter in psychotherapy, and I hope you do well. So the patients tend to regress. Oh, I don't know if I can do this. I don't. That's been so wonderful. So that's a regression, right? So it's not a repression. We talked about repression. We talked about suppression a little bit. This is a regression or going back to an earlier stage uh, that they do not think they can do. Okay. Okay. Well done, guys. So if you're looking for elevator cytokinase, you're looking for inflammation, you need to ask for a ESR or CRP labs. Okay. Okay, well done, guys. So if you didn't know, you could possibly get this answer correct by looking at belladonna, right? Belladonna and valerian, they both are for more like sleep inducing anxiety kind of feeling, and also catnip, which I call a catnap, right? Because it actually helps people go to sleep. So they all three of them fall in somewhat similar category. However, the blue options here is known to enhance sexual drive, especially males. What is it? Okay. Well, you guys got it all correct. I don't think there is need for explanation. Well done. You had a incident aggravation or stress, and then therefore after you had the symptoms, that is adjustment disorder. Do not get confused with major depressive disorder or anxiety disorder. Look at the question. Use process of elimination. Okay, well done. You saw someone on this team of the question saying IV, use of IV injection of some kind that should cue you in for HIV. So good job. Now I want to also call attention for dementia with HIV symptoms. If the question comes back with dementia and HIV symptoms and ask which of the following would you do, the only option to help the patient would be to start a antiviral medication, right? Because it can be confusing. But if the CD4 is low, the only thing that can help the patient is antiviral medication. Okay, so the question could give you more details, but in general, you do not change medications within 6 to 8 weeks. Okay, had the question said the patient's been on the medication for 12 weeks and give you like escitalopram 10 milligrams, what would you do? Still, you continue the same medication. Why? The patient is stable. You don't want to stabilize the patient by trying to decrease the dose, right? So pay attention, understand what the question is asking you. If you if you've seen the patient, most likely questions come like you've seen the patient first time, you give Prozac, Lexapro, um, whatever, and then the patient comes back 4 weeks later, and his score is high or his score is very low. What would you do? Nothing. You keep the same. The only time you change is increase of suicidality. So basically, it's the test makers are trying to trick you and giving you a high score or low score, wanting you to either increase the medication or decrease medication, counting that you don't know the principle of when should you change a medication dose. So pay attention on that because a lot of people fall for this specific type of questions. Okay, well done, guys. That is Prozac. The cue that I want to get away from this question is a higher placebo effect on children and adolescents compared to adults, right? Okay, that's a very good medication that you can use, Abilify, for period of irritability, right? So the question doesn't really apply for lithium. Clozaril, not first time medication for either hallucination or things in the nature. Do not use Clozaril the first time. Clozaril is only used when the SGA or FGA medication it's not available. And this is not a case for a antidepressant. So for the right answer here would be Abilify. Good job, everyone. All right. Everyone should get this one right, hopefully. Okay, very good, guys. Again, the three skinny medication, as I call them, they are the Geodon, Latuda, and Abilify, are the three that I like to put most emphasis on. When it comes to mood stabilizer, lamotrigine would be your first choice as far as preventing weight gain. Now, Zyprexa is a very well-known medication to increase metabolic syndrome, so increase the extra weight. It's actually a very good medication for inpatient when you want to price control, but according to most books, is a secondary medication due to the metabolic syndrome that it may cause. Understand what you do, what you need to assess before, what kind of labs you need to look out for, and what is metabolic syndrome is super high yield. It's covered in our course in detail as well. All right, 30 seconds. Again, these are law cases, very famous. We need to know them because they will show up. They are easy hanging fruit. If you understand them, you get them correct. We cover them in detail in our course. You need to know them. Okay, that is the Stark Law. Stark Law means receiving something for referral, eh, receiving monetary gains or privilege of some kind in order to refer. You cannot refer someone if there is a benefit involved for you. That is against the law, and that you could lose your license, go to jail, and so forth. Okay. Okay, guys. So here we have a questions with alcohol and depression. So the right answer is: have you been drinking alcohol to cope with your depression? Not an ideal question, right? It should have been: can you tell me more about your relationship with alcohol and depression? Open-ended question would have been a better question. However, if I looked at the blue there, can I refer you to alcohol treatment program that's still direct? It it's I'm assuming a lot of things. Are you ready to stop drinking? So that is also a bit condescending, and I probably shouldn't ask the patient directly that kind of question, right? And no one picked the yellow one. Do you drink socially? Again, yes or no question. Probably the best answer here would have been the: have you been drinking alcohol to cope with your depression? Still is a closed answer question. Better question would have been: tell me more about your relationship with depression and alcohol. Let the patient talk and speak freely. All right, Solomon is actually keeping the lead and not letting go there. We got 5 more questions. Neuronal death. What is it? What definition is that? Seconds left. Well done, guys. Most of you guys got correct. It's talking about neuronal death, right? So that's apoptosis, right? I can see why necrosis can be an enticing answer, but necrosis is about death, but it's not the natural death of the cell. And then pruning has to do a lot with the connections that that we make in our brain that needs to be pruning. Pruning has to do a lot with psychosis, right? But neuronal death is apoptosis. Disrespect for social norms and rules, aggression towards people and animals without remorse. These are super high yield cues for this question. Anytime you see it without remorse, think of a antisocial personality disorder in adults. And in children, there would be this condition, conduct disorder. It's very, very clear. Okay, in the question, it could not be more clear than this. This is a conduct disorder. In adult, would be a antisocial personality disorder, which are most likely to commit crimes and suicide and homicidal out of all conditions. Okay. What is the core concept in fear doors theory? Okay, so on his theory is all about the repression, right, of the mind, the unconsciousness that it's kind of our mind plays, our brain plays in our daily living. It's all about the repression, right, of the feelings and things like that. All right. Okay, well done. I would expect this question to get a lot of people due to a lot of misinformation out there. Somebody has a hot mic. Okay, so
I guess I got
yeah,
a quick question
go
for
ahead.
you. Is there any like a evidence-based thing for this answer as far as calling interview separate versus calling CPS? Any kind of literature evidence?
Well, I do not know exactly if there is a research on this specific topic, but hear me out, right? You are the professional. You have a chance to interview the patient separately, or B, do nothing and call the CPS immediately, right? Which one would you pick? You are there for crisis control and provide the patient safety. Now, if the choice of interviewing the patient separately is not available, then you look for the best option to protect the patient. So, does it make sense why it's not called CPS immediately? You call CPS immediately when you don't have a choice to find out more about the case.
I feel
Otherwise,
like I
what you
get
are
this one wrong half the time or all the
right.
time, because if I say call the police first, the answer is no, don't call the police first. And if I say, talk to the patient or talk to the family, then I should have called the police. I get it wrong every single time.
Yes, because every single time that the question is being changed, right? So that's why it's important not to memorize. Here, we hear a lot of an internet. Call the CPS, call the CPS. Well, you are the expert. You are testing as the PMHNP. Have you really stopped and kind of really understand what does it mean, right? You are the cream of the crop. I mean, that's what you went to school for. Now you are not a mere person that will follow directions. Do X, Y, and Z. You are the one calling the directions. Here you have a chance to interview the patient separately, right? So you want to gather all the information before you make a decision. Here, calling the CPS or calling the police would be equivalent to some degree, right? CPS would be more involved with the child, police will be more involved with the safety. So it's kind of like very close answer there. Now, refer the patient to a medical provider would be passing the buck. You don't want that. Now, let's say you see a patient playing with dolls sexually in a playground, and you don't have the opportunity to interview the patient or gather more assessment, then you do what's the next possible option. See, things do different how the question is asked. Is not immediately called CPS. That would be wrong.
Maybe I should have known because you couldn't pick the police answer over the CPS. So those
Yes,
must not be right. I could have maybe used test
that's
taking
the
strategies that way.
strategies here. Yes. And
Okay.
always remember, can you do something before you pass the buck? Right? Can you do something before you activate another service or system? If the answer is yes, for example, you have someone that you suspect a certain disease and you want to refer the patient to OB or PEDS, but one of the questions says collect the labs and then refer the patient to OB. It's not saying collect the labs, wait for the labs results and refer. It's telling you do something within your license, your capabilities, and then refer. By the time the patient is referred, the other provider have something to work with. So that's the key. Ask yourself, can I do something before I just pass it on to somebody else? Okay. Does it make sense on this question? A little bit.
Yes.
Yes.
Alrighty. Thank you.
Yes.
Pay attention because every time it can be one or two words or simply as silly as the nurse have checked with the Arizona State Nursing Board. So basically here I'm saying, hey, she checked and she now understand and the answer choice now has Tarasoff, then that could be the right answer because I'm saying, hey, I looked at my regulations and it applies. Even if it doesn't say applies, but it's saying I looked. So it's kind of really key with you in that if Tarasoff principle applies, then you should pick that. Call the person, you know. Now, if it doesn't apply, then which you should if it doesn't say that it apply, you should take it does not apply. Why? Because it's a national test. A national test cannot apply only to Florida State or Missouri or what have you. Nationwide, the Tarasoff principle doesn't apply to every state. So what do we have next? Call the police is always a great choice because you can never be wrong. But then calling the state nursing board of nursing can be also a great choice because they will inform you what to do. Can they both be in the same answer? No, because both are the correct answers. Okay. What is the question? Okay, well done, right? So the question is asking you, hey, someone that's in a hospital, they don't think they should be there, right? Basically, in lay terms here. You know, you want to take this case to the court. Arbor corpus is an important terminology and you need to know for your test, okay? All right, last question here for the day, and then we'll go over a few other things that is important as well. Speech, decision making, cognitive process, analytical thinking. Where do you find these information here? Cerebellum, medulla. Is it the pons or cerebrum? A lot of people confuse cerebrum and cerebellum. Okay, two of them are high yield. So as I mentioned, a lot of people confuse cerebrum and cerebellum. Right, cerebrum is the brain. Right, is the main meat and potato there. The cerebellum is the drunk guy. So cerebellum is the drunk guy because as you lose coordination, you do to the feet to heel kind of walk straight. When someone drinks alcohol, their cerebellum is affected, right? So they lose control, they lose balance. So associate cerebellum with balance. Cerebrum is the brain, and that is association with the frontal cortex activities mentioned in the question. So in third place today, we have Bandy. Good job, Bandy. You did it. Jeanette took the second place, and first place is all right, Solomon. Good job there. These are our students, Paul and Kat. Solomon, if you have not enrolled in our PMHNP psychiatric course or taking the first place today, I will enroll you for free. Just send me an email with your name and information. You gain today's event. You are being present with this course if you'd like to. So for now, we'll take a 5 minute break and we'll come back with the second portion, which is questions and answers of the content that we covered during our course. Today is the day that we meet and greet and kind of follow up with any questions. So I'll see you guys in about 8 p.m. Eastern Standard Time. Okay, so it'll be about 30 minutes from now. See you soon. Bye bye.